Okay, so today we're going to talk about breast cancer. Alright, so a quick overview of breast cancer. Breast cancer is a cancer that forms in the tissues of the breast. It occurs mostly in women, however, men can also get it as well. Approximately 286,600 women are diagnosed with invasive breast cancer each year, according to the American Cancer Society. Alright, some risk factors for breast cancer. Age above 55, alcohol consumption in excess, dense breast tissues, Caucasian females, women who have their first child after 35 or who never have children at all, those women who menstruate before the age of 12, or women who suffer from obesity. Alright, so some common symptoms of breast cancer. So first and foremost, you're going to have your lumps or masses felt within the breast. Painless hard masses with irregular borders. Those are the ones that are most likely going to be found to be cancerous. Other signs may include swelling, skin dimpling, breast or nipple pain, and the nipple discharge that is not breast milk. Some common types of breast cancer. You've got your invasive ductal carcinoma, so that's going to be the most common type. It begins in the milk ducts and invades the surrounding area of the breast tissue. And then you have invasive lobular carcinoma, which first develops in the breast and then invades the tissue. And then ductal carcinoma is confined to the ducts, and then lobular is confined to the milk-producing glands of the breast. Alright, so when it comes to diagnosing breast cancer, it's diagnosed through either a mammogram, ultrasound, or a breast biopsy. So treatment, so you have radiation and chemo, hormone therapy, and then there is medications, Herceptin, so that would slow the breast cancer development. And then there are your surgical interventions. So speaking of those surgical interventions, so you have a lumpectomy, which is removal of the tumor in the surrounding tissue, a mastectomy, which is the removal of the whole breast, a sentinel node biopsy, which is a removal of lymph tissue receiving drainage from the tumor, and then you're going to have, or an axillary lymph node dissection, which the lymph nodes containing the cancerous tissue are just completely removed altogether. So for education, that's really where I want to talk about prevention. So you want to remind all your female patients, and even men too, to perform regular self-breast exams and report any findings of new masses to their provider right away. And then lastly, prevention. This would be, again, in your teaching. So lifestyle factors, obesity, alcohol consumption, and healthy diet. Screening. So you're going to want to recommend biannual mammograms between the ages of 50 and 74. Again, those self-exams. And then you also want to play your part in spreading breast cancer awareness. So that's just a quick overview of breast cancer.